Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 5 starts now.
A high-speed chase through Oakland County ends in a massive crash. We're live from the scene with brand new information just in from State Police.
We're going to begin, though, with the coronavirus as the statewide numbers continue to spike. 1,719 new cases in just the last 24 hours. The data showing no signs of the pandemic slowing down in Michigan. Glad to have you with us here for Local 4 News at 5. The state also says 78 people have died in the last day from the virus.
Let's get you up to speed right now on today's major headlines. Moments ago, the governor just signed an executive order formally declaring a state of disaster. Mayor Duggan says work on the field hospital inside the TCF Center is progressing quickly. And you're looking at video of one of the city of Detroit's food distribution locations. Those are up and running as well.
Tomorrow, we expect Governor Whitmer to announce her decision on canceling the school year. Mayor Duggan also says the first rapid coronavirus testing machines have arrived in the city and could be up and running by tomorrow. Here's Mayor Duggan giving us an update a short time ago.
We have a very serious problem in the city. We lost a number of other members of our community even yesterday. But Detroit is hit early for the same reason Oakland County is hit early, for the same reason Kings County, Washington was hit early, for the same reason New Rochelle, New York was hit early. Somebody brought the virus into this community early on. It spread in this community before we knew what was happening. And the places in this country that are getting hit are the places that were infected first.
Today marks a real tipping point in the crisis. It has nothing to do with the number of cases.
April 1st today, and for millions of people, that means the rent is due. Today, our Victor Williams has more as he spoke with a man who works 4 jobs and yet can't make ends meet right now.
Yes, well, today might be the first of the month, April Fool's Day to be exact, but landlords aren't fooling around about the rent that's due, even in the midst of this health and financial crisis.
Unfortunately, it's a bad situation.
Essential worker Kenya Henry says it's been hard lately trying to make ends meet for her and everyone she knows.
Some people are prepared to pay their rent. Some people aren't.
Thankfully, because she can still find a way to work.
I take a Lyft or an Uber. That's $22 to work and $22 home from work. Equals out to a little bit over $200 a week for me.
She's been one of the lucky ones.
I'm one of those essential workers. I do have a check coming in, so I am able to pay my rent.
You're gonna get your money, you know what I'm saying? It's just it's the way you do it.
But there are so many others like Darius Bass who work multiple jobs.
All of my jobs, I got like 4 different jobs, and all of them are off.
And have no idea where the money's coming from to pay the bills.
But I talked to my complex today, asked them about rent, see if rent was still due. And they was like, yeah, of course it is.
And despite all that, he's willing to do what's necessary to provide for his family.
If I can't pay the rent, then I got a wife and 2 daughters at home that's going to be homeless.
And we know that some landlords are being lenient by getting rid of those late fees, even allowing their tenants to pay rent all the way up until the 30th. But even with that, I mean, some people are still going to have a very rough time. Reporting live downtown, Victor Williams, Local 4.
And the economic just part of the questions that so many people still have about the coronavirus, especially as researchers are learning new information every day.
Our Dr. Frank McGeorge is here with some rapid fire answers to several questions submitted through clickondetroit.com. Good evening, Doc.
Hey guys, yeah, I don't want anyone to think I haven't read your question. I have, I just don't have time to reply to each one individually by email. So I'm going to try to quickly answer some right now. Now, some have been touched on before, some are new with an update.
First question, is antibacterial soap necessary? No, any soap can eliminate and remove the virus. Next question, can coronavirus spread by getting in your eyes? Yes, it can infect areas of your body known as mucosal surfaces. Think of those as the moist pink areas of your eyes, nose, mouth, and throat. Next question, can you get coronavirus through a cut or eczema? Nope. The receptors or attachment points that the virus needs to infect you are primarily on those mucosal surfaces. Another question, is intimacy safe for couples? Yup, but that assumes neither of you are sick and there isn't some reason one partner might want to avoid getting the virus from the other. The deal is, intimate contact can transmit the virus, but if a couple is already sharing a space and not isolated from each other, then don't worry about intimacy specifically. Another quick one. Will a shot of vodka or whiskey prevent COVID? Nope, but don't we all wish? Incidentally, there is no gargle, beverage, or rinse that will prevent you from getting infected once it's invaded the mucosa of your respiratory tract.
Now, I have one more question. This last one is interesting, and there have been a couple similar to it that I've paraphrased. Here it goes. My husband, daughter, and I have been self-quarantined for over 2 weeks. We're doing our part, but when we are finally able to emerge, won't we just be infected later? It seems like a no-win. Okay, that's the question. And I totally understand your sentiment. Here is the upside to doing your part right now. First, by keeping yourself healthy, you are taking a load off the healthcare system while it is currently getting crushed. Now, second, while it's completely true you might get infected later, by then we might have more information on treatments, and eventually there will be a vaccine. But one final point, even after the stay-home order is lifted, people are still going to need to maintain social distancing and hygiene habits so we do not have a second wave.
That is all going to be complicated to think about when we get there, that's for sure. All right, more from Dr. McGeorge coming up. Now, tonight in the fight against coronavirus, there is continued tension between the federal government and state governors, bracing for a surge in cases and deaths over the next month. Alice Barr in Washington tonight, as Americans so far untouched by the virus are already suffering as they worry about how to pay their bills. Alice?
Devin, as the death toll rises and the economic impact deepens, the United Nations is now calling the coronavirus pandemic the biggest international crisis since World War II. It's the first of the month in a once-in-a-lifetime crisis, and as millions of out-of-work Americans struggle to pay rent and bills, some are already turning to soup kitchens for help.
We've seen almost a doubling in the numbers of people that we've served.
The economic devastation only outmatched by the horrific human toll. U.S. deaths topping 4,500 today, with more than 200,000 cases confirmed.
I want every American to be prepared for the hard days that lie ahead.
The Trump administration now expects as many as 240,000 Americans to die in coming weeks. Staggering numbers experts say will be much higher if people don't follow guidelines to stay home.
The mitigation and social distancing clearly works. We need to put our foot on the accelerator and not on the brake.
But without a nationally mandated stay-home order, the response varies state to state. California and Washington now predicted to see fewer fatalities because they acted early, while more than a dozen governors still have not issued statewide orders. One of the largest, Florida, finally did today.
Even though there's a lot of places in Florida that have very low infection rates, it makes sense to make this move now.
State leaders also pleading for federal help with desperately needed medical equipment, saying states are having to bid against each other for life-saving supplies, driving up prices.
You will run out of staff before you will run out of beds. And you may run out of equipment before you run out of staff.
In the midst of the shortage, medical experts now considering advising regular Americans to wear makeshift protective face coverings while saving high-quality masks for the healthcare workers on the front lines. Health experts say the biggest benefit for everyday Americans beginning to wear some kind of face covering, even just a scarf, may be to prevent people who already have the disease but don't know it because they're not showing any symptoms from spreading it. In Washington, Alice Barr, Local 4.
An important point. All right, Allison, we are expecting the daily live update from the president and his task force from the White House. We'll take you there live just as soon as it gets underway.
Well, the second quarter is off to a rough start on Wall Street. At the end of trading, the Dow, S&P 500 and NASDAQ finished down 4%. Experts say investors fear the coronavirus will keep the economy shut down longer than expected.
All right, let's switch gears now to Oakland County and a chase that hit speeds of over 100 miles an hour and ended in a terrible crash.
Sky 4 was over the chase as it ended right here in Sterling Heights. We want to get to Mara McDonald. And Mara, you just got an update from state police on injuries.
Karen, what we're hearing is that the driver of the car that wrecked here is in critically grave condition. The passenger that was in the car with him is expected to survive. Now, our chopper caught all of this as it was going down. Once you see the video, you'll understand why. Take a look. Our chopper rolling as this multi-county police chase is about to come to an end. You can see as the driver loses control. This is the aftermath on the ground near 16 and Dodge Park.
Car parts are on the sidewalk. It looks like a bomb went off.
According to MSP, the man behind the wheel of this SUV and his passenger were wanted on an armed carjacking and several other incidents in Detroit and East Point. He led multiple departments through multiple cities, starting in Detroit, heading up the Southfield Freeway into Oakland County, and ultimately heading through Troy and through neighborhoods, not just main roads. You can see him going off-road from the chopper on his way into Sterling Heights, going at some points 115 miles an hour. He loses control here, somehow managing not to hit anybody else.
When I talked to a couple that was over here that lives by this, heard the noise, they came over, saw him getting him out of the car, and he was in some pain, moaning and groaning. And when I walked up, they were putting him in the back of the ambulance.
Back here live, the latest update from MSP is that the driver who caused all this is in critically grave condition. We're live in Sterling Heights tonight. I'm Mara McDonald. Back to you.
Pretty understandable. All right, Mara, we've got a lot more to come here on this Wednesday. Let's check in with Ben.
Devin and Karen, some lucky folks getting a little break of sunshine, but most of us still have clouds. And believe it or not, there are still sprinkles on 4 Live radar. We'll see when we get them out of here. Coming up.
Sexual predators are out there, and they may be more laser focused than ever before on communicating with your kids. I'll tell you why, and also you'll hear the important warning from the head of the FBI office here in Detroit.
A young woman from Warren has major lung issues. She cannot leave her home for any reason during this COVID-19 outbreak. The thing is, she's also a nurse.
I want to be alongside my team, and it's frustrating that I can't.
And tonight she'll tell us how hard it is to just stay home when she's trained to be fighting on those front lines.